Hi everyone, good afternoon. I am Jose Garcia, a technical lead for Android developer with Rebecca's account, Zoom account, a long story. But in any case, thank you for joining this session about local innovation and COVID response. Yeah, let's get started then. So as you know, as you have heard from the previous sessions, right now, DHIS2 is being used in more than 30 countries for COVID response and surveillance, which is impressive, I would say. Also, from a global perspective, UIO has been implemented and deployed global packages, metadata packages for COVID, for entering data for COVID, and for analysis as well. Okay, that I would say that has been widely accepted by the community. However, this pandemic, the COVID, is bringing us some challenges as well. Some challenges that they have to be addressed in a rapid way. I can think of, for example, countries need to use real-time reporting tools that need to be scaled fast. Okay, and other challenges like about self-reporting, in which the end user is not the health provider anymore, but in this case is a person that may have COVID symptoms or even is a positive COVID case as well. Okay. Also, we are talking about making complex analysis about contact tracing, that I think is really important in this context. So all these challenges were driving several innovation solutions at a local context. Okay. I think that this local innovation just expand the DHIS2 model, the DHIS2 functionality, just to meet the country's demand. Okay, so what we are going to see today is 3 use cases which are really addressing some of these problems and making a real impact in the field. Okay, we are going to see how people are using other technologies with DHIS2 in order to improve the data collection, in order to improve data flows, and in order to improve the analysis for decision-making process. Okay. So our first guest is Bram Piot and Phaykeo, both currently living in Laos. Bram is the Senior Surveillance and Monitoring Advisor for PSI in the Southeast Asia, and Phaykeo is the Senior MIS Supervisor. So guys, you have 12 minutes to present your demo and the presentation, and yeah, over to you.
All right, thank you. Thank you very much, Jose. So yeah, thanks a lot for the opportunity to present our little case, use case over here. In this presentation, we'd like to highlight the recent work that we've been doing on social media chatbots connected to DHIS2 as a new tool for disease surveillance. Our original abstract that we submitted back in April was actually on the implementation of a Facebook Messenger for or a chatbot for malaria case reporting in the private sector in Laos. However, as it did with many things, the COVID-19 pandemic, of course, somewhat changed our plans and by extension, also our presentation today. Because it led us to adapting our tools, this malaria chatbot, to strengthen surveillance of COVID-19 and of other diseases. The main reason why we were looking here at PSI Laos for a new approach for malaria surveillance last year was the realization that routine disease surveillance systems typically lack efficient and scalable reporting tools. And also that the private sector is often underreported, or it's maybe not even included at all in national HMIS, and that it is left aside. So whereas healthcare providers such as doctors and pharmacies, they need a simple and user-friendly mobile tool that doesn't require specific apps or accounts. We wanted to make it really easy for untrained or low people with low digital literacy to report data. And in this case, it was malaria cases, but we'll see that this can be extended to other types of data, of course. For us, it was really important that we came up with a solution that doesn't require intensive training or complex software or app installations, and that would come along with very heavy maintenance procedures. So I think that we've all seen the vast range of digital solutions for mobile data collection, for routine data reporting that have been developed over the years all over the world. Many of these are, of course, very powerful, and they may be either generic apps or highly specific tools designed for a very specific use case. But for the most part, they're often quite complex and often also costly to deploy because they require significant investments in terms of training of system managers and end users. They also need, they're quite heavy on the procurement side oftentimes, where you need to deploy hundreds, if not thousands, of mobile devices. And that's especially the case when you deal with community level surveillance. Or the lowest level of the health pyramid in health posts, health centers, pharmacies, private clinics. So there's obviously a lot of challenges with these different elements, and it can of course be overcome, but the challenges associated with software maintenance and device compatibility as upgrades are needed, of course, on a regular basis. Remote user management. We heard even yesterday the challenges in Android deployments of managing users, troubleshooting, upgrades, requiring sometimes quite intensive mobile device management solutions. And also last but not least, of course, HMIS integration. So these mobile tools for routine data collection and disease surveillance, they're often very difficult to deploy at scale. And they may also be hard to maintain, so they present sustainability challenges. Now, about a year ago, PSI Laos, the team here, embarked on a journey to try to see if they could come up with a simple yet quite revolutionary solution. And this came down, in our case, to developing an interactive chatbot for malaria case surveillance using Facebook Messenger. And first thing to know is that here in Laos, internet for many people equals Facebook, and everybody uses it, or people who are connected are all familiar with Facebook. That's what they use to communicate with their friends. They send messages, they look up the news, and they're very familiar with the platform. So by workers, we're given the possibility to start using a highly familiar communication platform in their own language, on their own mobile device. They didn't really need any separate accounts, no passwords, no applications to install on their phones or tablets, and all of this with very minimal training because the interface was so familiar to them, and because the chatbot essentially does everything else, right? Once you start the conversation, the bot will guide the user through the various reporting requirements, and that ease of use was especially important because a lot of these users may only need to report data occasionally, because that's typically the case in malaria elimination settings, which is the case over here in Laos, where many areas only see a small number of malaria cases every year. So unless you use an app on a very regular basis, it becomes hard to remember how to log on, or which program to look up, and how to report your data. So, in its simplest definition, a chatbot is it's a service that's powered by rules and sometimes by artificial intelligence, where a user interacts through a chat or messaging interface and following a set of rules or a workflow. And it's as simple as that, right? You interact with the chatbot to report data in this case. So it can be used for many other things as well. Of course, I mentioned the challenge with integration of others with other systems and existing systems. It's something that has been mentioned a few times in past sessions as well. So one of our requirements was, of course, that the bot would be fully compatible with DHIS2, which is our main MIS platform at PSI, but it's also the platform on which the national HMIS here in Laos is run. We'll see how it works from a technical perspective in one of the next few slides, but essentially it means that any data that's reported through the chatbot gets uploaded automatically in a program or a data set in DHIS2. But so before we do that, let's see how we apply the bots within our regional malaria elimination project in Vietnam, in Laos, in Myanmar, in Cambodia. and starting with Laos. So I'll hand it over to my colleague Phaykeo for the next slide.
Thank you, Bram. Hello, Jose and Rebecca, and hello, everyone. Actually, PS Allows has been using Facebook Messenger's chatbot since last year in 2019. Now, 124 outlets, or about a third of our network providers, are using Facebook Messenger chatbot for reporting malaria data from the field to our DHIS2. How to use it? The user just open up Messages app on their phone and simply type a large greeting message somebody, and then chatbot keep asking the user questions when the user responds to it until the end. The malaria data includes patient gender, age, village of resident, type of malaria infected, treatment provided, and so forth. The user receive on-site trainings on the use of Facebook Messenger's chatbot by medical retailers who often take supportive visit to the field. On our network providers, particularly those who have own smartphone and use a Facebook account, are encouraged to register for using the chatbot for reporting their malaria cases. Another interesting is that to make consistent with the government reporting system, SMIS, the chatbot recently was updated with the common data points often set, like the name of villages, district, which are used in the government system. In fact, the confirmed malaria cases are automatically transferred to SMIS in malaria basis through the data integration app, which is embedded with our DHIS2. Apart from increasing convenience and flexibility of reporting data for the government, this app increases the confidence and reliability of data use and sharing between our organization and the government agency. That is from my side. Now I give the presentation back to Bram. Thank you.
Thank you, Phaykeo. So very quickly in Vietnam, we developed a very similar chatbot, and it was very much built on the same model. The only difference, or the main difference, is that we built it on a different platform, which is called Zalo. And you should know that Zalo is the most popular social media platform in the country. So the process is very much the same. It just shows that you can build these chatbots on any, let's say, any compatible messaging service. And what happened in Vietnam, though, where we were deploying this back in March, April, because of the need to strengthen COVID-19 surveillance, we recently updated the bot to also accommodate for other fever cases. There's a lot of overlap between malaria and COVID-19 symptoms, and a lot of the people who come with fever and who we test actually don't have malaria, they have something else. So in general, we feel that it's important for us to expand the range of symptoms and diseases that we can report from our private sector network. And the COVID-19 surveillance or fever case chatbot, as we call it, is being deployed as we speak in a number of hundreds and potentially even thousands of pharmacies and some private clinics. And these will be used as an additional layer of surveillance for COVID-19 in Vietnam. And so it will become possible to identify clusters of suspected cases because they're not confirmed. We don't do rapid testing as we do for malaria. Again, this is where the availability of simple reporting tools in the private healthcare sector becomes really relevant, because it's precisely in the private sector that most people will actually seek care for fever or for other reasons. In Myanmar, we're now also piloting a Facebook Messenger bot for malaria reporting. Again, very much the same. This is happening in our extensive social franchise clinic network throughout the country. And we also intend to open this up to other notifiable diseases. And this is actually part of the work that we're doing as part of our Emergency Operations Center Strengthening Project in support of the National Ministries of Health, where we work towards strengthening overall disease surveillance and response systems. Again, the private sector has an important role to play here, but with the potential to expand to other sectors, of course, as well. And actually in Myanmar, the first confirmed COVID case was detected in one of our clinics back in March. So let's see briefly what's under the hood, how the system works. I won't go into too much detail, but essentially, developing these bots is really not very complex, and experienced developers can get this done in a matter of weeks. The workflow logic, including the skip patterns and validation rules, is all hosted in a web service and uses a library that enables extraction and translation to structured data in DHIS2. The data are submitted to DHIS2 through the API, which is possible because all the data elements and option sets and user accounts are mapped to the corresponding metadata in DHIS2. And again, these are just the basics. We can do a lot more cool stuff, such as fuzzy matching based on extensive lookup tables, sending SMS and email notifications. We can send data to multiple programs or even simultaneously to different DHIS2 instances, which makes it possible to report both to the HMIS and to our own instance. And so again, lots of interesting things that we can develop in future iterations of these channels.
Bram,
some early lessons. We
are over time, Bram,
yes.
Sorry. So maybe one more minute to wrap up.
I have one more slide, just very quickly to say that there's a few early lessons that are coming up around the fact that the users really like that they have a familiar interface, local language, through very easy, easy app. The bottom line, though, is that users do want options. There's no one-size-fits-all solution, right? And this will not replace traditional case notification systems. They're still needed for early detection and containment of epidemics. We still need active user management, of course, by central MIS teams. We need to have user enrollment and mapping user IDs and so on. But on the bottom line is that, again, it's very simple solution that has a potential to be expanded to other notifiable diseases and even for other simple mobile data collection needs. So we are still working on this and hope to present on our progress and maybe future opportunities here in the Oslo conference or elsewhere. So thank you, everyone. And with this, I will hand it over back to you, Jose.
Okay. Thank you. Thanks a lot, Bram. Very clear explanation, and it's a pleasure to see this working, to be honest. And I think that then our next guest is Zeferino, who is the head of DHIS Mozambique. So Zeferino, over to you whenever you want.
Hello, everybody.
Hello, Zeferino. Hello.
I'm not sure if you can see my slides.
Yes, we can.
Okay. Good afternoon, everyone. My name is Franz Jen, and I'll be presenting or sharing the experience, our experience as Digitals on behalf of a team, DHIS experts that are sitting in Mozambique and Guinea-Bissau. So then the idea here is to share kind of experience during the implementation of DHIS2 COVID response, on the DHIS COVID response. And sorry, I need to switch. Okay, so I think now it's okay. So during the COVID response, and also to see how we have what we have done so far during this process of implementation. So this is going to be the outline. So as it was mentioned before, we did receive, there was a DHIS COVID package that was developed based on the experience from Sri Lanka. I think Pamod is going to talk a bit more when he does his presentation later today, I think following. And we did this package have been developed, and then we did receive the package from the University of Oslo and adapted that package and adapted the package to be used in the country that we are supporting. So as a South Digital, we are supporting 5 the Lusophone community, and especially in Africa, they're all 5 countries. And then we did get the package, and then did the translation and provided that package to the different countries that we are supporting. The package came with mainly the three programs, and within this program, it's possible to do the screening of point of entries and register and follow up cases, negative cases on quarantine, suspected and confirmed cases, and also on the case-based surveillance, it was also possible to register information related to lab testing, and also the isolation and follow-up with positive cases. When we took the package presented to our users, and then we identified some local needs. So those needs were customized. So for example, we did have this hotline information, a call center that were set up, and then the information was, the tool that we are using, at the time they were using paper-based tools, and then some of them they're using Google spreadsheets. So we had to convert those tools into DHIS2 so that all information could be stored and find in one place. We did also include inpatient case management. There were a situation where the health workers wanted to track positive cases, so we had to also to do those adjustments in the package so that they could be able to follow up the cases. Also the assessments that were done in the health facilities for the health workers, for example, and also to look at the situation of the COVID preparedness in each of these health facilities. And all these came from different countries, and then we had to adjust them and then make them available to other countries as well. With regard to the use, we did find 2 possibilities. Some were using or are still using web-based, and then they also combined in some situation where they're using Android devices. And at the moment, almost all the countries, except of San Tome, all of them they are using Android devices at some point. But also there's a combined, those that are sitting at the national level. Some of them they use web applications to do follow-ups and then to do some statistics based on the information that is collected from every level of the information. These are some examples of what was generated. So we do have, for example, the dashboards here showing information, the hotline, the number of messages, for example, that recorded in the system, and then we have also scorecards that were developed here to see the situation of the health facilities per week, to see if they are improving with regard to the preparedness or the situation of sanitation in the health facilities. And then on the right side, we also have some of the dashboard were developed to do the trend, to look how the situation of the cases, if they're increasing or not, comparing suspected, confirmed, and also those that were there, let's say, deaths. With regard to we did also do extension of those some were internal from within the system, that we did also expand it to be able to display them, some of the selected information to the general public. So these are examples of the web portal that we are linked to DHIS2, and where original data is extracted from DHIS2 and then provided to the public so that they can follow up the cases, and then they know the situation. As you all know, the protocol or the countries that have been sharing every day the situation of the COVID situation, the surveillance unit specifically. So what we have done after that, information, for example, have been presented in conferences, and that information is also provided on the web, or in this case, taken from DHIS to the web portal. So with regard to the innovation aside, so we did find with dealing with some country limitation in the tools, and then they wanted, for example, to know how to track specific cases. So we did develop hubs that within DHIS2 that could enable the surveillance officers to trace the cases, and then, for example, based on it is based on the referral model that from DHIS tracker we produce this case tracing application. So when you go there, you will be able to see what are the health facilities that are provided services to specific cases. For example, if one specific patient is transferred from one health facility into another, so this hub is able to provide you the different places where the different services are being provided. Also, we did have the request to also be able to provide the contacts. So as we know, the package came with the possibility of registering the contact for one specific positive case. So and then it was not that easy for you to be able to list all the positive contacts that are linked to one specific index case. So we expanded the app to be able to show, for example, in this case, you will see one specific patient, the female here had 46 contacts, but then we couldn't see on the list of that easily. So we had to develop this app that lists all these positive contacts, the contacts for this positive case, and then based on this positive, on the contact, we could also show or display other contact if there is one specific individual that was linked or connected to these cases. The other innovation or feature that we have to also to add it was at some point when the provinces or the airports or the point of entries were crowded, people coming, and then we should check the number of staffs were very limited, and then the time that were spent, for example, to be at the registration, or it was too long. So we had to find ways of reducing that time. So in this case, the app was developed that anyone could register the information, specifically the personal information, and when they arrive at their destination, the health worker only access the information based on the QR code or specific code. They access that information, and then they can validate and enter only the information related to, for example, the temperature, and then whether the case is discharged or not. Those are the fields that were added so that this process could made the process a bit more flexible, so that since the passenger or the traveler was able also to fill that information or prior to his travel, or even when he arrived at the airport, he could go there, scan, and then do the preliminary entry. And when he goes to the health workers, and then could have the information, and the health worker was only entering the fields, few fields. So the app, this is the flow, and then we have this app that has these two possibilities where you can also here scan and then enter the related information to the specifically for the traveler. One of the challenge that we faced, it was in some of our countries, especially this is for Guinea-Bissau, where it was the printing of lab results, and then the lab where in the beginning it was only one lab at the national level, and then but the results or the lab sample were collected from everywhere. So the process was all the samples were sent to the lab results to the lab on the national level. The lab was doing the test, everything. Once the results were out, they had to get the file, get the result, and then seal the paper, and then send that result all the way to the place or the facility or the community where this case or the sample was sent from. So, and then they approached that, they said that we wanted something that we could use the system to generate that. So what we have done here to expand that, the tool, in this case, within the DHIS, we could list all for example, we could list all the exams that were entered, and then we added there the possibility of printing that result. So anyone that has access to the DHIS could go, once the result is sent, there's a notification that is sent the person that, okay, your result is ready, and then that's based on that, you could go to the health facility and then ask the health worker that have access to DHIS, they could go there and then print the result and then provide to him. That was
Zeferino,
Yes.
sorry, we are over time, so you need to wrap up in 1
Okay,
minutes.
okay, thanks. So that was one, and then we did we added that into that app the possibility of because that was internal inside of DHIS, that we wanted someone to also to be able to access that result from the web. So we added, apart from going directly to DHIS, anyone could go, the traveler, the consumer could go to the web portal and then using his codes detailed, and then could get that. And then once he gets to the airport, the app, for example, here in this case, validates that result based on the barcode that was provided that is printed. So as a conclusion, we did have some challenges. We do have some challenges, especially with engaging with several stakeholders. As you know, with the pandemic, there are a lot of people coming, trying to support, so a lot of tools coming, and those was one of the challenges. The trainings, and we are, as you said, we are located in 2 different countries, but we are supporting several other countries, and then we had to do most of our training virtual, and then where you have issues with connectivity. So those were some of the challenges. The strategies that we adopted is so partnerships were one of the key that drives us to make sure that this is happening, engaging with the new stakeholders, also having these innovations here that could help, for example, to address some of the needs, and also the most important, I think, having this community, being engaged with the developers and DHIS, the DHIS devs from Oslo and other countries. That helps a lot. We were having always, every day, let's say, often meetings to discuss the challenges and then finding ways of addressing many of the issues that we are facing. So this is what I have for today. Thank you.
Thank you, Zeferino.
Thanks.
Thank you, Zeferino. Very interesting. Super interesting, I would say. So Pamod, is your turn, and we can extend a little bit our time. Okay, so you have around between 12-14 minutes. You and Austin. So whenever you're ready.
Right. Thank you so much, Jose. I don't think I will take 12 minutes. I will try to finish as early as possible. So I will explain in my presentation about the local innovations around COVID-19 in Sri Lanka. And towards the latter part of my presentation, Austin will take it from there and explain how these local innovations became global. So good afternoon, good morning, good afternoon, good evening, everyone. So I'm Pamod, representing HIS2 Sri Lanka. So I will take it forward from where I left in the plenary session. So what you're seeing here is the timeline of COVID-19, the disease progression, as well as the information system implementation on COVID-19 in Sri Lanka. So as you can see, we started off in late January, and by late April, we were kind of having an ecosystem of COVID-19 surveillance system with more than 7 components. And what I would like to highlight in this presentation is one main event that happened, which is the hackathon, which happened around March, the mid-March, and then 2 main products of that one, the contact tracing application and of course ICO Bit Management module. So let me just start off with ICO Bit Management module. So now what happened was towards the end of March, we saw a sudden surge in the COVID-19 patients, and of course some of them were critical. So country was very concerned because we did not have a proper integrated ICO Bit Tracking mechanism system. So they wanted something very simple, not a complicated one, just to know the status of available COVID-19 ICO beds in the entire country at a given time. So there were a few requirements which were kind of possible in DHIS2, as you can see here, which is of course registration of ICU beds in the system, and add and remove ICU beds by the hospitals when required, and of course to show the current status of the bed, the particular bed, and of course some basic information about the patients. I mean, all of you, the DHIS2 implementers, would know that this is a simple tracker implementation of DHIS2, but the issue that we had was a bit more complex, which was of course, I mean, there were a few things which are not possible from DHIS2 out of the box. So they wanted to see a map and the locations also marked, and in the same interface, like it's a data entry interface, and then show the distance to the nearest ICU bed available. And most importantly, they wanted a very simple interface, not so they felt our tracker was a bit too complicated. Right. So what happened was, now in our system, we had the majority of the modules were customized in the DHIS2 based surveillance system. But of course, we needed some development, sometimes to support the customized content, but also we needed to develop new content, which were not possible with the core application. So this was where this hackathon became very important. So it was a simple call. So what happened was, like, the DHIS2 Sri Lanka and all the other stakeholders that you are seeing here, the ICT agency of the government, development community, everyone got together. So the ICT agency took the initiative, and they made a Twitter request asking all the volunteer developers in Sri Lanka, inside the country or outside, please help us build something customized on DHIS2 platform. So what happened was, we got an enormous, very, very big response, and we declared this weekend over 14th and 15th March this year. And over the weekend, you are just seeing only 2 people here, or 2 or 3 people, but there was a big community, about 20, 30 developers who joined online and worked on these custom web applications to serve the functionalities which are not possible with the core DHIS2 applications. So this was a massive effort, but we never expected that people would really contribute. But this really happened at a very large scale. And I must also mention the support we got from University of Oslo, because what we ensured was, like, whatever we did in Sri Lanka, we kept in touch with the DHIS2 community, especially the University of Oslo, so that we can get support based on the agile things that were happening locally inside Sri Lanka. So we informed the University of Oslo, and in fact it was Austin, the core developer, who was made available during this weekend to support the local developers to take it forward. I mean, whenever they had some issue, Austin was available. In fact, the collaboration happened based on the ICT on a Slack platform, a Slack account which was created by the ICT agency. So all the developers around the globe and the UIO developer, as well as Sri Lanka, was available to make things possible. So this is what you're seeing is some interfaces from the ICO Bit Tracking application. So it's a very simple one. I mean, actually it has only main two UIs. So the first one is actually showing where the available ICU bed is, and then we have a separate interface to mark the status of the ICU bed. So that was all that they wanted. And the one issue was this ICU staff had not used DHIS2 previously, and they found that a tracker interface, the tracker capture interface, a bit too confusing. I mean, that was their opinion, but we were able to do something really fast based on this collaboration that we had. And then the next application, of course, was the contact mapping application. So requirements, again, some were possible just out of the box, like registration of confirmed cases, registration of contacts, and of course, building relationship between cases and contacts. So this was just possible with the core DHIS2 applications. It's basically the tracker was possible to do it, but these things, I mean, to have a visual representation mapping the case to contact was not possible. And then again, maybe to display some attributes, whether it's male or female or some other case number, something like that, next to that particular entity in the map. This was also not possible. And then they had some additional requirements, such as like obtaining mobile tower data of the suspected persons, as well as cases where they have traveled during last 2 weeks, also integrated into this contact mapping application. And then of course, so basically this thing, this had to be integrated, and it was an additional feature. So these were not really possible out of the box, and this is where we had to make a custom web application. So our team, the local team, with of course support from University of Oslo, they were able to design something really fast within like 1 week, something like this. So this is a basic contact mapping visualization. So basically it is showing from which case to which case the disease transmitted based on the information that is obtained from hospitals and epidemiological studies. And also this supported visualization of some basic attribute information like maybe male or female, or how many contacts, and then again, maybe like the EPID number, so that kind of thing. But then again, what happened, something interesting happened, that when we posted about this in the community of practice, we noted that this is not something unique, and there were so many other countries who were wanting this. So then this is where, in fact, the University of Oslo took it one step forward and tried to identify the generic requirements and to make the app more generic. So of course, Austin is going to talk more about how this was done. I'm not going to touch on that, but so basically, with the help of Austin and his team, we were able to produce something like this, which is a generic application for contact mapping visualization, which is now available in DHIS2 App Store. So that way we were able to make some local product, something local, the local innovation, and we were able to cast it to the broader audience by making a generic global product. So what I will do is I will just stop here, and Austin will take it forward from here, explaining more about the web application. But I will just mention this one last slide, which is of course the tower data location tracker. So basically, what you're seeing here is all the confirmed cases with, of course, the consent of the persons as well as with the authority of the government. They were able to trace the GSM tower locations during a defined period of time. So here, of course, it's 2 weeks, and we were able to make that visualization on a map, so that this will assist the contact tracing process. So this was again another integration, a custom integration that took place around our COVID-19 effort. So thank you so much. I will just stop here about local innovations about this contact mapping application, and Austin then can take it forward and explain how it became global. Thank you.
Thanks a lot, Pamod. Yeah, it's been really great to work with the Sri Lanka team on, as Pamod mentioned, several innovations and different web applications. As Grant told me just a moment ago, we are going to need to wrap up pretty quickly so that everyone can get to the plenary session in a couple minutes. So I will make this very, very short and introduce you to some of the feedback loop that we're developing and that we're trying to enable with DHIS2 as a platform, which is not only supporting local innovations with the global platform that is DHIS2, but also feeding back the learnings and the needs of those local innovations to enhance and improve that platform. We did that very well, I think, with this project with Sri Lanka and with several other organizations, and we want more involvement from the community. So definitely don't be afraid to be involved in that discussion and to talk to us about how we can improve that platform to enable the local innovations as Pamod mentioned. I'm not going to get in too much to the details of this application because we don't have too much time, but as Pamod mentioned, we did make this a generically available application that can be adapted to different metadata models, different types of relationships and tracked entity instances. That's available on the DHIS2 App Store, apps.dhis2.org. We took a number of the learnings from that application, the development of it, and fed that back into the generic tools that we make available to web app developers. I'm not going to go into those too much today. They were involved saving and loading different visualizations into the user data store, as well as using reusable layout components. And we're also taking some of the learnings from those applications to enhance the core analytics engine and the tracker capabilities of DHIS2 itself. To learn more about these this innovation system and how we try to enable that feedback loop between local innovations and the global platform and the generic capabilities of DHIS2 as well, we have a number of sessions coming up over the next 2 days. They're here. They're also on your schedule under the tech track. The first one will be at 2 o'clock Central European time tomorrow, introducing this whole topic. So hopefully we'll see you there. And with that, I will quickly wrap it up to pass so that everyone has time to get over to the plenary session, which is starting just about now. So I hope that was okay, Grant. And thank you everyone for joining us today for this great discussion about local innovation and the COVID-19 response on DHIS2.